Thank you for your purchase of your digital dock camera. I want to spend a few minutes here talking about how you can use your digital dock cameras to increase case acceptance. And I also want to provide you an even longer video to get in more depth, but I want to respect your time and keep this very, very short. So a couple things that I want to really contemplate on how to improve case acceptance, whether in hygiene, whether you're doing it in the doctor's operatory, just how can you use these cameras more effectively. One of the best things that you can do, of course, is take a picture of the problem area. And the more magnified that problem area is, the better it is. A picture is worth 1,000 words. I don't think I need to explain that to anybody. But it helps the patient to understand, because now you can point right at what you're seeing and have a conversation. What's interesting to me, if you really want to, if you have a real simple little procedure, nothing complex, but for your simple procedures, one of the most powerful questions you can ask a patient when you pull up the image and you look at it is to go, wow, what do you think we should do about that? And I don't say that to undermine your authority as a dentist and as a doctor. I say that because what I want to do is invite the patient to be a part of their own diagnosis. Really what I want to hear the patient say is, gee, doc, I don't know. What do you think? Because the minute they do that, they've given you the power and authority to diagnose and give that to them. What I find so often whenever we present treatment to patients is we say, you need. And the challenge with you need statements is the patient's not engaged, they feel lectured, maybe belittled, and what we want to do from a perfect perspective is get that patient engaged. Patients make decisions to change things for one of two reasons, and there's literally only one of two reasons in my opinion, from a psychology perspective. They either want to gain pleasure or they want to avoid pain. And in a perfect world, to get a patient to say yes to treatment, we would like to use both of those methodologies to inspire a patient to accept your treatment. So the more that we can get them engaged in this process, to get them co-diagnosing, to get them as part of it, owning the diagnosis, the easier the acceptance process gets. So I find one simple way is to throw a picture up, show a crack of a tooth or whatever might be going on and go, wow, check that out. What do you think? And you don't necessarily have to say, what do you think we should do? But what do you think? And the patient's response 80% of the time will likely be, gee, doc, I don't know, you tell me. So it just gets them engaged. It's a simple little scripted question you can use. But going to bigger cases, now whether or not it's more of a cosmetic and you're trying to use your cameras to improve that case acceptance rate, I really want you to contemplate every time you've ever purchased something. Think of a car, a home, a vacation, anything you've ever purchased. If you really go back and you think about what you were trying to accomplish, were you not trying to either gain pleasure or avoid pain? You know, maybe the avoid pain was I need to take my wife on a vacation because she's been really upset that I've been working a lot of hours and I'm trying to avoid the pain of her being upset with me or a divorce, right? Or I'm trying to gain the pleasure at the same time of having fun on this vacation and reconnecting with my spouse. Just a few examples of what I'm trying to illustrate. I just find it's so prevalent in decision making. So when we're talking about dentistry that needs to be done, the camera's the perfect tool to help this because it allows us to show them the pain that could be coming. Hey, look at this crack. If left alone, what'll happen? You see this little cusp right here? This thing's going to go and just fall off like an iceberg into the water. Or we can show you the pleasure of, hey, look how amazing this is going to look. Look at your top arch, how amazing it looks. Look at your bottom arch and how it doesn't match and doesn't look amazing. So we can offer you the pleasure of a beautiful smile that you feel like you don't have to use your lower lip to cover your teeth. There's so many ways that we can use intraoral cameras in the psychology of behavior change. And we're going to leave you a link that'll be up at the end that'll get into great depth about all of this so you can really understand this. It's probably a 20-minute, 25-minute video on the psychology of case acceptance that gets into this in great depth. But I wanted to give you a small flavor of this now so you know what to do. And I find that a couple simple questions, like I said, hey, what do you think about this? Or another great question to take a full face picture. Digital dock is one of the only cameras, if not the only camera, aside from your digital SLR, that's very cumbersome, that will take a wonderful full face picture. All you got to do is put the glow attachment on and you're set. You have an amazing picture. But if you take that full face picture and then you look at the patient and go, hey, how would you rate your smile? Scale of 1 to 10, 10 being the most amazing smile ever. Where would you rate your smile? And most people will say 7 or lower. And if they have a bad smile, they'll say something low. But even someone who has a great smile likely will say 7 or lower. And the follow-up question is the key here. And the key is to say, what would it take to make this a 10 for you? And it sets up such a perfect cosmetic conversation, a gain pleasure conversation. So simple question that will really, really help. And the use of the camera first, look at the smile, look at their face and go, what would make it a 10? Is a wonderful thing to do. Lastly, I want to thank you for your purchase of your digital dot cameras. They're such an amazing tool. I hope you get great value out of them. If you implement our 12-in-2 formula that we teach, you will get great value out of them. The only question is, will you use it the way that we teach? And I want to also leave you a person's phone number, a single person you can call anytime you have questions with your cameras. Not technical questions, because the technical questions need to go to the support team. But if you have questions on how to integrate these and how to interact with your patients, you can always call your local digital doc rep for sure, absolutely. So I want to thank you. Digital Doc is a family-owned business, and we're so appreciative of your willingness to trust us and to put our cameras in your office and for us to be a part of your life, your family, and your practice. We're so thankful for that and so appreciative. Thank you again for your time and your appreciation in your business. Have a wonderful day.